Welcome to my presentation titled Intersecting Marginalizations, Financial Barriers to Healthcare for Trans-Disabled Communities. My name is Elijah Foran, and I'm a recent graduate from the University of British Columbia with a Master of Arts in Interdisciplinary Studies. As a bit of background and overview of my research study, when I set out to do my master's research, I wanted to focus on healthcare access for those at the intersection of transgender identity and disability. Little research has explored the experiences of trans-disabled folks, and given the high rates of disability among transgender and gender-diverse people, this area was of particular interest. I used semi-structured qualitative interviews with 15 trans-disabled community leaders to examine the experiences of this population attempting to access healthcare. And while I didn't ask specifically about experiences of poverty, financial barriers were highlighted in every interview and became a really important component of the study. Financial barriers and poverty were identified as central obstacles that shape healthcare access, quality, and frequency, as well as one's overall health and well-being. By highlighting financial challenges faced by trans-disabled individuals, this study illuminates how intersectional oppression intensifies healthcare inequities. There are three main themes that I want to highlight from my research findings. The first theme is about legislated poverty. It is well established that financial insecurity disproportionately impacts disabled communities. This economic precarity is compounded by policies and programs that, while intended to provide support, often limit opportunities for financial independence. For example, participants described the experiences of accessing provincial disability benefits, specifically British Columbia's PWD program, as a very paradoxical system that keeps them in poverty, with one participant explaining, quote, "I'm paid 40% below the minimum wage, so how am I supposed to afford these things? I shouldn't have to be choosing between food, rent, and medical care." The amount of funding provided fell short of meeting basic living expenses, and rather than functioning as a pathway to financial stability, PWD was experienced as a mechanism that maintained participants in long-term economic precarity. The next theme was about out-of-pocket healthcare expenses. So while Canada's healthcare system is often framed as universal, participants highlighted numerous hidden costs that significantly restricted their access. These included fees for treatment not covered by the government, including mental health counseling, certain prescription medications, and costs associated with gender-affirming care. When asked about whether their health needs were being met, one participant explained that only about 33% of her health needs were being met, because that was approximately what was covered by the public insurance. The notion of free healthcare in Canada, they argued, obscures the extent to which low-income and disabled people shoulder significant out-of-pocket expenses, and at times this completely prevents access to needed care. The last theme speaks to the impact of financial support. When participants accessed financial support, such as mutual aid, extended health benefits, or familial support, self-reported health outcomes improved markedly. One participant explained, quote, "I do have health insurance. Her parents have been paying our rent. We've got support, so we've been able to focus on healing." Access to financial aid allowed participants to have more secure access to housing and food, afford essential medications, and engage in preventative rather than crisis-based healthcare. Participants stressed that financial resources were essential prerequisites to healthcare access and improved health outcomes, yet emphasized that for many, this was rarely attainable. Overall, this research underscores the urgent need for policy interventions that are informed by the lived experiences of trans-disabled people. Findings from my research highlight systemic gaps in income support and healthcare access, which directly affect health equity. Policy recommendations need to be informed by meaningful consultation with trans-disabled communities and could include expanded funding to enable accessible and affirming healthcare and targeted investments to help address social determinants of health in order to reduce structural barriers and promote economic security for trans-disabled individuals across Canada while also improving their health outcomes. Thank you so much for listening.